Good morning, this is Dr. Fletcher with your Monday Motivation. We are going to be highlighting some lab testing and things to think about in your health that maybe you're not really at the forefront of your attention, or maybe you're not really addressing with your primary doctor. One of the topics that we see a lot of is thyroid disease. And I'm going to talk a little bit about the test for thyroid and why you want to think about getting these added to your panel. So hypothyroidism is one of the most common chronic diseases in this country. Over 11 million people have hypothyroidism, and disproportionately about 8 to 9 times more women than men have hypothyroidism. So that's a high number of us for the ladies. About 5% of women, even up to 10% of women, can develop hypothyroidism. What's interesting is that there are a number of people who actually go undiagnosed, and in a recent study looked at upwards of 5% of people are going undiagnosed with hypothyroidism. Part of that is because the symptoms are rather nonspecific. Fatigue, weight gain, headache, constipation, and the list goes on. And you may be thinking to yourself that you may have some of these symptoms. The most common causes of hypothyroidism worldwide actually relate to iodine deficiency, but that's not really what we see so much in the United States. More commonly here, we see hypothyroidism as a result of autoimmune conditions, more commonly Hashimoto's. So when we're talking about testing, we need to be aware that since this is the more common type and root cause of hypothyroidism, that we want to be including those types of tests. So when going to the doctor and looking for common testing, most commonly you will get what's called a TSH, a thyroid stimulating hormone. Unfortunately, the precursors for hypothyroidism, particularly autoimmune disease, can be existing for 3 to 5 years prior to your TSH actually becoming abnormal, which is why we actually encourage, and when we see patients, but if you're not seeing us, to be looking at the other tests that are looked at for autoimmune mechanisms, specifically TPO antibodies and thyroglobulin antibodies. We also recommend and do tests for the actual thyroid hormone itself, which is thyroxine. So you're looking at T4 and T3 levels. So it's these whole panels of tests that are looked at. One other test that you may not have heard of is called a reverse T3. We like to think about that as kind of the brakes on the management of your thyroid. So managing thyroid certainly is addressed with medications, which we won't talk about. But upwards of 50% of people don't really feel optimal, even when their thyroid is said to be within normal range. So looking at the specific labs, ranges, and certainly personalizing that to you can become very valuable with your health care. We encourage you to become aware of the types of tests that are out there and be open with discussing that with your doctor when you're looking into testing and optimizing the management of your thyroid in this case. Hope you have a good day.